the Aurora Health Alliance thought it was important to focus on firearm injury prevention and policy issues related to that. That's not to say Aurora Health Alliance has taken policy issues on anything that is discussed, but we do have the ability to. We wanted to highlight the work that's being done in this area, both from Moms Demand Action and from Children's Hospital Colorado. Here is our firearm prevention statement. So firearm injury is a serious and preventable public health crisis in our community. We pledge to be informed, share resources, and promote existing firearm violence prevention efforts. So that is what we will be talking about more today. Here are our speakers. Emily from Moms Demand Action, and then Andrea from Children's Hospital Colorado.
Again, I'm from Moms Demand Action. I'm wearing my Be Smart shirt because I'm going to tell you about our Be Smart campaign today. I want to first of all, thank you so much for the opportunity to speak with you today. My name is Emily Farr. I am a mom of two. I have a son in 3rd grade and a daughter in 1st grade at Westwoods Elementary, which is a school in Jeffco Public Schools. I am also a longtime Moms Demand Action volunteer. I started volunteering with the organization back in 2014. And my day job is I'm an attorney. I'm an employment lawyer based in Arvada, Colorado for a California company. In June of 2020, in the middle of the pandemic, when I know everyone was confused, overwhelmed, and angry, there were civil rights demonstrations happening, and we were all feeling pretty low. I started a local group with my co-lead Amanda in my neighborhood at the time of Chicago, which is called Humboldt Park, Logan Square. I first met my co-lead at a vigil for a 9-year-old girl, Lena Nunez, who was shot and killed while watching TV in her home, just a couple blocks walk from my home where my kids would often do the same thing. When I moved to Arvada last year, I immediately found the Jeffco Moms Demand Action group led by our fearless leader, Jen Wallers, who is on this call. Thank you, Jen, for giving me the opportunity and for your leadership. So what I want to do today is just go over a quick agenda and then get into it, get to the things that I think will be interesting to you. I'm going to give you a little overview of Moms, why we're here, talk to you a little bit about how we're structured our campaigns, and then I'll end with some opportunities and some other information for you as well. But I'm always available in the future to talk about moms in general, Be Smart, and other ways you can get involved. All right, so Moms Demand Action, if you haven't heard of it, is a grassroots movement full of volunteers like me across all 50 states. Our founder, Shannon Watts, founded Moms Demand Action in 2012. And at the time, Shannon had been a marketing executive. But at that moment, she was a stay-at-home mom of 5 kids in Indiana who, like many of us, remembers where she was standing the moment she heard about the shooting at Sandy Hook Elementary that killed 20 children and 6 of their educators. Shannon started a Facebook group that day, and it was really just a Facebook group. She had under 100 friends, as she likes to say. She didn't have solutions. She literally just felt a desperate need to connect with other parents. But what started as a cry for help became a constant drumbeat for change. We often say moms are everywhere, and that's because we really are. We attend events that are small and large with various different types of constituents. We'll meet on phone, on Zoom, we'll meet in person, really wherever we can to educate and build awareness. And I do want to point out we're not just moms. We like to say we're mothers and others. We include dads, of course, and grandparents, aunts, uncles, and friends. When I started my group in Chicago, one of my executive leaders was not married and she wasn't a mother, but she had more at stake than many of us because every single day she went into a 3rd grade classroom and she was very passionate about this issue. As we have grown as an organization, we've also specialized, and that's one of the things I wanted to mention to you today as healthcare providers. We have different caucuses in Moms Demand Action. Caucuses are not just for Iowa. We have our own caucuses, and they are focus groups, essentially. We have one for healthcare providers. We also have one for gun owners because gun owners are overwhelmingly in favor of reasonable laws pertaining to guns, and we welcome them into our group. Now, everyone always wants to know the why. Why are we here today? Why are we here as an organization? In Colorado, in particular, guns, like all over the country, are a major public health crisis. 75% of gun deaths in Colorado are suicides, and 21% are homicides. Now, homicides, of course, are awful. And ones that are random seem at times to do more than just make us cry. They can actually make us stay inside, make us into hermits, turn us into people who are afraid to even live our lives. And I don't want to take away from the awful reality it is to be a victim of a loved one's homicide. I've unfortunately met many people who are. But I also want to highlight this Suicide Awareness Month. Suicide doesn't always make the front news. Suicide can hold a lot of stigma. But about 1/3 of gun deaths in this country are unfortunately from suicide. And as you'll see in this chart, in Colorado, that number is 3 out of 4. So take a moment to think about that. 3 out of 4 gun deaths in Colorado are by suicide. In a state with a rich history of hunting, it's not a surprise that folks would have guns. And again, there's nothing wrong with it. But is there a moment when we stop and work on solutions to curb these deaths, or do we turn the other way? And I know I'm preaching to the choir here today. You are in healthcare for a reason. We do not plan to turn away. I know you don't either. So I want to highlight some of the solutions and how we can use our expertise and access to a patient population to impact people in a positive way. I also want to point out, as I do so, that we purposefully as an organization stay really local and get involved in what matters and what is an issue in our local area. We're a movement of parents, students, family, gun owners, survivors, mayors, and other people concerned about gun violence. And we work really hard to understand the forms gun violence takes, how it impacts our community, and to prevent gun violence by changing laws at the federal, state, and local level, educating people about secure gun storage and the tools available to them, which I'll get into soon, and really changing the culture around this issue. A couple of days ago, I was driving down a narrow part of Easley Road. Some of you may be familiar, near Golden. And I spotted a Department of Transportation sign all lit up. It read, "Stay 3 feet from bicyclists, Colorado state law." This is not a sign put up to patronize or question the ability of me as a driver. The sign is a tool. It's a public health tool. It reminds responsible drivers that there's a law to help prevent injury and death of bicyclists by cars, plain and simple. We know that cars can kill bicycles, and we know that distance helps reduce the deaths because if a car doesn't hit a bicyclist, the bicyclist will not die by the car. Similarly, in Colorado, we can do more to educate people about the laws that will reduce gun deaths. And I'm going to summarize 2 today for you. You're going to see the acronym SMART. This is our Be Smart campaign. I'm proudly wearing this shirt. Be Smart campaign is here to help educate people around Colorado's safe storage law, which if you're not familiar, was signed into law in April of 2021. In March of this year, CU Anschutz Medical Campus released a research letter calling attention to minors in Colorado's easy access to guns. And the statistics were quite shocking. Here they are. Nearly 1/3 of middle and high school students in Colorado report they have access to a gun. Of those reporting they had access, 25% reported access in 24 hours, meaning they could obtain a gun within 24 hours, and 12% reported access in less than 10 minutes. Just like a car veering into a shoulder will at some point kill a bicyclist, an unsecured gun will at some point kill a child. Enter Colorado's safe storage law. In case you are not familiar, it is a Class 2 misdemeanor to fail to responsibly and securely store your firearm. And what responsibly store means is that you know that it is locked behind either a safe or in another area where nobody has access to it, nobody knows the code. We have a law, and now we have a program, Be Smart, that educates around that law. The Be Smart program is one of my favorite campaigns in Moms Demand Action. I used to be a Be Smart lead in Chicago before I founded my own group. And what it does is it focuses on education and awareness about gun deaths and responsible gun storage. It is designed to help parents, educators, and others normalize conversations about gun safety and take responsible actions that can prevent child gun death and injury. Sadly, every year, 600 children, 17 or under, die by suicide with a gun. So it's another factor related to our staggering suicide numbers. In several states, gun violence is the leading cause of death for children. So where can healthcare providers help? Well, two places come to mind for me: in the exam room and at the front desk. In the exam room, asking patients about unsecured weapons in the home can help educate and remind them of the risk. At the front desk, providing gun locks, no questions asked, could make a huge difference. And it's something that other groups are considering doing as well. I hope you take pride in the fact that healthcare workers are the most likely to be viewed as trustworthy by the American people. As a lawyer, I'm very envious. But in all seriousness, I can tell you, we could really use your help, because people don't think of healthcare providers as political, and they don't think of you as having an agenda. They simply think of you as having their best interests at heart, because you do. And that's why having these conversations around safe storage and providing things like gun locks can make all the difference. Another thing that we have in Colorado is called ERPO, or the Extreme Risk Protection Order. They're also known sometimes as red flag laws. ERPOs are orders from a judge after it's been determined that an individual is a risk to themselves or others. This law allows family members, law enforcement, or household members to request a temporary removal of firearms from people who are deemed an extreme risk to themselves or others. Alerting law enforcement officials to concerns you have about a family member who has access to a firearm can, of course, save their life and others. And across the country, these laws have been implemented, and they do work, but unfortunately, they are often underutilized. We would appreciate healthcare providers spreading the word to those about their loved ones and about this idea of, utilizing this tool, an ERPO. However, as a lawyer, I understand we have due process for good reason. And because of that, the person who might want to file an ERPO often is a bit intimidated, right? You're going in front of a judge. There is a hearing. You have to take off time from work to go to the hearing. This can all be things that are roadblocks, so to speak, for people to move forward with an ERPO. So short of an ERPO, I want to be realistic. What can we do? Well, one of the things that we do at Moms Demand Action is advocate through the One Thing You Can Do campaign. The one thing you can do is remove a gun from a situation where someone might be at risk of harming themselves or others. It reminds people that in an urgent moment of crisis, you can drastically reduce the risk of death in your home by removing a gun temporarily. I will say I've never until recently had a firearm in my home. That was my choice. Right now, behind lock and key, I have a gun to fingerprint safe in my basement, and it is a friend's fingerprint safe from his home. He was in a mental health crisis. After getting permission from him, my husband removed it and put it in our home. This is an example of one thing you can do in order to help reduce the risk of death. All right. So I've gone over two of our campaigns and two of the corresponding laws in Colorado. I also want to point out that we're involved, in addition to, throughout the community, in schools, of course. Now, school shootings are everyone's worst nightmare. Thankfully, school shootings are a small percentage of all gun deaths in this country. But as we all know, the numbers in the United States dwarf other nations, and it's obviously a huge preventable problem. This is another way that we can work to use the safe storage law to reduce deaths. School shootings will be reduced by reducing access to guns and educating others to look for signs that a student is in crisis. In up to 80% of these school shootings, shooters do obtain the gun from their home or a relative or friend's home. And in most of these incidents, 93%, there are warning signs that could prevent this from happening. Many of you are probably familiar with our Safe to Tell program in Colorado, which is a wonderful anonymous reporting tool, but we can do more. In addition to working with educators to make our schools safe, I'm proud to say that Moms Demand Action works with schools in an equitable way to make sure that we are assessing threats in a way that doesn't, in any way harm or adversely contribute to a school's discipline policy or equitable practices. It's something we take very seriously here at Moms. And I know as healthcare providers, you're probably curious about that as well. All right, finally, as I wrap up, I have to talk about elections. It's an odd year, but we still have them right here in Colorado, and we'll have a big election next year. We do get involved in elections here. We get involved through phone banking, door-to-door canvassing, identifying and training candidates as well. And because of it, we have a gun sense majority right now in the U.S. House of Representatives. Again, that's not based on party. It's based on filling out our survey and showing us that you are behind sensible gun reform. And that has led to the passage of the Bipartisan Safer Communities Act in 2022, which was the first federal gun control legislation enacted in the last 30 years. It did a lot of wonderful things, extending background checks, making it illegal to traffic guns or buy guns for others, known as straw purchasing. It provided funds for states like Colorado to implement their ERPO or red flag programs, provided funding for crisis intervention programs you might see at your healthcare system. And it closed the boyfriend loophole, which was a loophole where convicted domestic abusers could actually still purchase a gun if their victim was not their spouse, but rather a boyfriend or girlfriend. So in addition to working on campaigns, there are obviously times throughout the year where we still stay involved with the legislature. We have advocacy days twice a year. Moms Demand Action will attend hearings, testify in person, write letters, etc. We are doing all we can do in different fronts in order to move the needle here. And these are just some of our wins. Safe storage of firearms, as I've mentioned, is now Colorado law, 3-day waiting period. We have raised the minimum age of firearms to 21. We have implemented, of course, the red flag law and prohibited the manufacturing of ghost guns. In addition, there is another law that was passed that requires individuals who own a firearm to report the loss or theft of the firearm within 5 days of discovering it stolen. And in very exciting news, you may have heard, because I know it's part of the public policy division, we now have an Office of Gun Violence Prevention in Colorado after Governor Paula signed that law in 2021. The office is run by the wonderful Jonathan McMillan, who we've had the pleasure to get to know, and I encourage you to look at his work as well. If you want to get involved at an individual level, you can always download our app. We have an app, like most organizations. You can also go to momsdemandaction.org to find all this information. But we would really encourage everyone to get involved, sign up. You will receive texts that have to do with issues and events near your zip code. It's just a wonderful group. There's also a volunteer interest form I just have to put out there for people to get that visual in case you'd like to donate some of your time and talents to the organization. All right, so that kind of wraps it up for me. I would love to take any questions. I know I talked a lot, but again, we just really appreciate the opportunity and the platform to speak with you. We really appreciate the work you do every day for your patients in the community, and we're happy to be here.
Emily, thank you so much. Really great information and great work that you do. We had a few, some action happening in the chat. One question that came through is, what are things that the city council can do with regard to firearm injury prevention?
Oh, wow. That is a great question. I mean, I think that I'm trying to stop sharing my screen. There we go. I don't know. I don't want to put Jen on the spot. I know she's on the call. She's been going to city council meetings. I mean, we always want to pass resolutions that we can having to do with firearm safety, storage and whatnot. We obviously have still been trying to pass other laws that are either stuck in the Capitol or just haven't made it even that far to debate. But we would love to meet with anybody who is on a city council to talk about how we could get involved with issues that are impacting them locally.
This is Jen. Sorry, do you want me to?
I'd love for you to add to it because I know you've been to these meetings.
Yeah, thank you so much, Emily. Hi, everybody. My name is Jen Woolers. Emily mentioned I'm the lead of the Jeffco Moms Demand Action Group, and I'm lucky to work with Emily on these issues. And we did have quite a campaign last year with city councils in our area. One cool thing that we have in Colorado is city councils are allowed to go up and above what the state laws are. So for instance, you saw that, for instance, in like the Boulder, Louisville area a few years ago, they passed some laws like extending the waiting period to buy guns, raising the minimum age to buy guns, that sort of thing. And that was sort of the framework that then became our Colorado laws the last few years. And so, you know, on a specific policy level, one thing that city councils could look at is banning assault weapons. However, that is a little bit legally in the air because there is a lawsuit pending on those laws in Boulder. But if there are further ordinances that city councils are interested in at the, you know, on gun violence prevention, then we can work with them. With our partners at Everytown, they will have, you know, draft laws that they have already written out with the lawyers and the lobbyists. So yeah, there is a lot we can do at the city council level, and that can be an inspiration for laws to happen at a bigger level, like at the state level. So thank
Great, thank you. A few other things in the chat to note. Mandy put the link for the Bill 21-1106, the safe storage of firearms. And then regarding the gun locks, Jen, thank you, put in the chat. If anyone's interested in partnering on distributing gun locks, please let them know. And we'll certainly include contact information in our outgoing follow-up email. And then Mandy put in a few links. Again, we'll include all these links in a follow-up email. There is a question, what kind of gun locks do you all disseminate? We're looking into doing something similar. So if you could speak to what kind you use.
So I can speak to what I've used in the past. In Chicago, we would get donations rather regularly about the gun locks. I don't know if we have them specifically here in Colorado, but they were the kind, I don't know the name. They just have the loop and the click at the bottom. So they thread through the weapon so it can't be fired. I know there's also some talk about locks that are specifically for cars because vehicles are apparently the #1 place where guns are stolen. So I know that as well, but I think they tend to be pricier. So yes, the cable locks are the one. Thank you for putting that in. The cable locks are the ones that I'm familiar with, only because I think they're more cost effective.
Great, thank you. And Brittany put in the chat, cable locks, trigger locks, and lock boxes are what we distribute.
Oh, it's wonderful.
Yeah. Emily, I'm wondering, you mentioned briefly Everytown. Could you speak to Everytown and what that piece of your work is?
Sure. So Everytown is the organization, I think of it as an umbrella organization that is where Moms falls under. So Everytown started a while back by Mayor Bloomberg. It was the mayors for gun safety, and Moms Demand Action sort of folded into the group. So Everytown really is where we get our, you know, if you donated to moms, for example, you're donating to everytown.org, and then the money is, you know, dispersed to the Moms Demand Action groups, you know, based on whatever the donation is for. So it's really like our parent company or parent organization.
Gotcha. Thank you.
Andrea is going to talk about things that are going on at Children's Hospital and things that within this realm that the hospital has supported, and hopefully we can help to make some connections with those efforts within our membership. So Andrea, thank you so much for being here.
And thank you, Mandy and the Rural Health Alliance, for inviting me to present today. My name is Andrea Stojsavljevic. I'm one of the senior policy coordinators on the government affairs team at Children's Hospital Colorado. So I oversee a few different issue areas for our team, one of them being injury prevention, which obviously encapsulates firearm injury prevention in particular. There are certainly elements of the presentation that will be redundant and overlap with what Emily has already presented on, so I'll try and breeze past those few points as we get to them. Yeah, so these first two slides are just to provide some baseline information around Children's Hospital and then framing, you know, how firearm injuries and fatalities impact children here in Colorado in particular. So here at Children's Hospital Colorado, we are a level 1 pediatric trauma center. So that means we provide the highest level of complex care for injured children 24 hours a day, 365 days a year. We see and care for more children than any other hospital in our 7-state Rocky Mountain region, and we are privileged and lucky enough to have a robust injury prevention program focused on a variety of topics ranging from child passenger safety to firearm injury prevention. Brittany Lombard, who put some comments in the chat, is one of those amazing team members we have on our injury prevention team in particular. And then lastly, we also have an advocacy team that works on policy at both the local, state, and federal level around youth mental health, public health issues, injury prevention, and more. So really, that's all to say that the broad scope of our pediatric trauma services really begin with prevention and includes pre-hospital care, emergency, diagnostic, surgical, acute, and rehabilitation, as well as research, education, and advocacy. It's all part of our mission to prevent injury and help a child who is injured to get back to the business of being a kid as quickly as possible. Thanks, Joe. And in terms of keeping kids safe and framing some of the research on the issue, there's a really great research article around the multiple epidemics of fatal and non-fatal firearm injuries in Colorado children that I just wanted to highlight a few of the research and statistic points for you all. So from 2018 to 2021, firearm injuries have increased in Colorado children who are ages 0 to 19, averaging almost 1 injury per day. The firearm mortality rate in Colorado children also sadly averages more than 1 death per week and exceeds the automobile injury mortality rate and has become one of the leading causes of death in children beyond the newborn period. We also know that Colorado's firearm suicide rate for children is the 11th highest in the United States. And the firearm mortality rate in Colorado children is increasing as the firearm ownership rate increases, and that's estimated by the cumulative number of background checks for firearm purchase or transfer. So the bottom line is, in Colorado, the common denominator to injury and death in children, whether it be accidents, suicide, homicide, is access to firearms. So here at Children's Colorado, we're here to partner in finding research-driven and evidence-based solutions to this complex but critically important issue in terms of keeping our kids as safe as possible. And so wanted to highlight some of the legislation that we've supported and worked on over the last couple of years, both at the state and federal level, some of which Emily has already mentioned, but wanted to provide some additional context on why that support, what the evidence is behind those pieces of legislation. Thanks, Joe. So on the state level on this slide, I won't go too big into the Colorado safe storage legislation, but the reason why this one was important in particular is a recent national survey estimated that almost 30 million children in the US live in households with firearms. And although multiple studies have found that living in a household with a child under the age of 18 is associated with higher rates of secure firearm storage, a 2021 survey indicated that in nearly half of households with both firearms and children, guns are stored unlocked. And so, as Emily already mentioned, safe storage laws are aimed to reduce unintentional firearm injuries and deaths, suicides, and violent crime among youth, chiefly by reducing children's access to stored guns in the first place. We also know that safe storage, laws like this and education promote safe and responsible firearm storage practices, which furthers the goal of protecting children and communities from violence, unintentional shootings, and self-harm. Also, as Emily mentioned, the Office of Gun Violence Prevention legislation was also passed in 2021. The thing I wanted to highlight in particular, one thing that they already have stood up is a grant program. So if you visit their page, you can see who the recipients are. But they have provided about $450,000 in grant funding to support community-based gun violence prevention initiatives throughout Colorado. The funds from the grant program are being used for education, training, and community programs that promote and support responsible gun ownership practices, safe storage, awareness of existing laws, and mental health and substance use resources. And if you visit that page, you'll also see a wealth of data. They recently released their 2022 annual report, so we are keeping tabs on that office in particular and their efforts moving forward. Lastly, in terms of state level policy, wanted to highlight Senate Bill 169 in particular, which increased the minimum age to purchase firearms. And Senate Bill 169 prioritizes gun violence prevention by raising the age of purchase of long guns, such as rifles and shotguns, from age 18 to 21. We know that research shows that laws that set minimum age requirements for the purchase of firearms are intended to decrease the number of suicides, homicides, and unintentional shootings among young people. On this piece of legislation in particular, I know the hyperlinks you don't have access to them in this slide, but we worked with, some of our providers to write letters to the editor in the Aurora Sentinel to highlight the importance of Senate Bill 169, and also a different article on the comprehensive package that moved through the legislature. Our lovely Dr. Maya Haas, who works in our emergency department, also was engaged in that effort. We also worked to help prep some of our residents and providers to testify in both committee hearings on this bill. I think the only thing I wanted to caveat with this one in particular is that currently Senate Bill 169, in terms of going into effect, is being held up in our court system. The Rocky Mountain Gun Ownership Group filed a lawsuit, and so this law is currently in limbo while that lawsuit plays out. And then the next slide is related to federal level child health policy and advocacy. I think we can breeze by this one. While our current federal government is in the nicest way a little bit of a hot mess express, they were able to pass the super important piece of comprehensive legislation in 2022. We can move on, Joe. Advocacy for the future. And so Colorado's legislative session runs through January through May every year, and options for folks to stay involved. On that little QR code on the side, you can sign up for our Child Health Champion Network. It's really our way of keeping advocates up to date about kids' health policy. It's not specific just to firearm injury prevention, but all the issue areas that we follow. And really is meant to provide opportunity to quickly and easily speak up for issues for children in particular. But during the legislative session, we encourage folks to track introduced legislation at ledge.colorado.gov, to identify opportunities to testify in committee, to come down to the Capitol and speak to your legislator about issues that matter to you, and really to find the advocacy organizations, whether it's Children's Hospital or Moms Demand Action or other groups, to really get involved and stay in touch. They're usually really good at letting you know about the opportunities that matter to you and prepping you to testify in committee or speak to your legislator. So I encourage folks to do that. I think that is the end of my presentation, but happy to answer any questions. And I know Mandy will be shooting out our emails to the group as well.
Are there other hospital systems engaged in this issue, or is Children's Hospital the outlier with supportive legislation?
I actually would have to circle back on that piece in particular. I know other hospital systems are definitely engaged in this issue as it boils down to injury prevention and what they're experiencing in their emergency departments in particular. I know the Colorado Hospital Association has been involved in some of these efforts in particular, especially the ERPO expansion bill that was ran last legislative session encapsulated healthcare providers in particular. But I cannot speak on every hospital system and where they're at, but I think there is a consensus in terms of making sure that we keep kids as safe as possible when we think about firearm injury prevention.
Andrea, thank you so much.
Thank you for the opportunity. Appreciate it.
Here we are, ending on time, so thank you all so much.
Thank you again.
Thank you. Thanks, Emily.
Thank you.